Greetings, y'all. I am Candace Maria Dru, Columbia, South Carolina native. I am a senior apprentice midwife, holistic lactation consultant, small business owner, and my sister's keeper. I know this conference is for all of my sisters, so I will keep most of my Candace talk geared towards general women's health. Occasionally, I will tie in a bit of my expert advice regarding pregnancy and birth. As you guys will hear during the panel discussion later today, birthing Black women have a higher risk for everything, and there's a reason for that we can easily pinpoint. It's because we aren't prepared to protect ourselves. We don't know how to prepare our partners and support persons to protect us. We just don't know what we don't know. So today, I'm here to shed light on quite a few things that aren't general knowledge. My prayer for today is that the wisdom I share becomes the wisdom that you share. My first point that I'd like to address is, by definition, protect means to keep safe from harm or injury. In order to protect ourselves when receiving health care, we have to do our part in protecting ourselves in everyday life. For me, protecting myself in real life looks like knowing when I need a moment, requesting labs to check my vitamin and mineral levels so my body can function optimally, drinking half my weight in ounces of water daily so that I not only look good, I feel good. This glow you see isn't from a stress-free life. I'm drinking my water and eating intentionally. I'm engaging in physical activity when I have the capacity. I'm a living room yoga kind of girl, or I'll play the cha-cha slide and turn my whole family up real quick. The conference theme, decompressing after a year of thriving, is a powerful phrase. As I meditated with that title on my heart, I had to admit to myself that it is such a daunting phrase for me. So I had to ask myself why. Why does decompressing after this year I've had sound so scary? So I had to ask myself, why? Why does decompressing after this year I've had sound so scary? It's because I prefer to lead by example as best I can, and I have finally admitted to myself that I am struggling. I am tired. I don't have a true planned break in sight. I don't currently have the support or resources to even take said break. I quickly had to check myself because I can decompress while still carrying a heavy load. It doesn't take immense privilege to decompress. Practical ways that we can decompress daily is by taking a few moments to deep breathe. So I would like for you all to try this with me. We will inhale to the count of 4 and then exhale to the count of 8. So let's inhale and exhale. That felt really good, right? Let's do that one more time. Let's inhale to the count of 4 and exhale to the count of 8. Last time, this time, let's set our intentions of our breath to releasing whatever on our heart is worrying us. So let's inhale. Now release, blow it out slowly, control that breath. We just took a moment to decompress in the middle of our Blaze Summit. Decompressing can also look like talking it out, whatever it is. Someone in your life may have the capacity to help you decompress. And if you are still building your personal tribe, decompress with your journal. For the things we aren't comfortable, for the things we aren't ready to talk out, write it out. And when you write it out, close up that journal. Imagine yourself temporarily closing those problems, burdens, situations, or whatever it is. It may not be going away exactly in that moment, but in that moment, you can choose to give it a rest and redirect your thoughts. Decompressing can look like stepping outdoors for fresh air, meditating, calling in sick, taking a day off, reading for leisure, disconnecting from social media. When we aren't mentally and spiritually well, when walking into healthcare settings, we are more vulnerable than we can comprehend, which leads to things being done to us versus for us. We may or may not understand what our options are, or we are so distracted that we are just signing consent forms and agreeing to medications and treatments without weighing our options and fully understanding what's going on. That's how drifting through survival mode can have long-lasting effects on us. During my Candace talk, we will discuss advocacy and understanding our bodies, taking off our mask so true healing can happen, doing our due diligence, protecting ourselves during pregnancy, following up, and sharing our experiences. So my first point, advocacy and understanding. Let's talk about appointment times and doctor visits. Do you feel seen and heard during your visits? Are they too quick to feel confident in your diagnosis, treatment plan, and future plans? Know that collaborative care is okay. It is okay to have an entire care team also. My 5-year-old has an entire care team consisting of an integrative medicine physician, a pediatrician, a chiropractor, an allergist, an ENT, a pulmonologist, a dentist, and a developmental pediatrician. What one doctor can't answer, the next one can. We have to normalize getting a second opinion before making a big decision, especially when you hear phrases like, you will need to take this medicine or treatment for the rest of your life, or you need to have your gallbladder removed. It took a doctor I met online to give me an alternative perspective to gallbladder removal. As I've been told, it has to happen and the gallbladder serves no purpose. When later learning that our livers are 100% dependent on our gallbladder, so we could have it removed and then have lifelong effects that we now have to deal with. Let's dive into diagnostic labs and testing. How often are you having blood work done? Do you know that most of us in the United States are deficient in essential nutrients that our bodies need to function optimally? When is the last time your vitamin D level was checked? Are you taking the vitamin D prescription from your doctor, or are you taking a quality vitamin D supplement that your body can actually absorb? How are your iron levels? Do you normalize chewing ice and being cold? Or do you take a quality iron supplement that doesn't constipate you and disrupt your everyday life? At least once per year, we should have the following labs ran: a CBC, which is a complete blood count, a CMP, which is a comprehensive metabolic panel, essential nutrients panel, which shows our iron, vitamin D, vitamin B12, and magnesium levels, and also a broad thyroid panel that not only tests your T3 and T4 levels alone, those don't give us the full picture of how your thyroid is actually functioning. And the last test we should have, at least once a year, is one on inflammatory markers. Having a CBC and CMP ran annually is vital to understanding our electrolyte and hydration status, kidney function, liver function, and blood cell values. These values will also tell us if we are fighting an acute or chronic infection, having anemia, or clotting issues. Knowing our status in regard to essential nutrients lets us know what we can work on. Knowing our levels for inflammatory markers alongside these other labs is the foundation for preventative care. Mild inflammatory markers are directly associated with depression, cardiac events, and so much more. Next, I'd like to talk about powerful language. Sometimes we have to advocate for ourselves by using language that actually triggers the doctor to listen to us or to move and do more, to actually hear what we're talking about. So sometimes we have to use phrases like, please document my records to reflect that you are refusing XYZ testing. Or you may say, may I speak to the charge nurse if you're working with just your regular nurse on shift? And sometimes to the charge nurse, you may have to say, may I speak to the director of nursing? Because no means no. Know that you have the right to refuse any and everything being offered to you. Your no can be temporary also until you gain further understanding of what is being presented. Last year, when I was hospitalized for a condition I am still working through, the nurse walked into my room with a vial of medicine and said, I'm gonna put this in your IV now. I said, no, you're not. You're not gonna just do anything. First, you are going to tell me what that is, what it is for, what are the side effects, risk, what is the goal for this medicine, what is the expected amount of time and doses you plan to give me? Tell me more, and then I will let you know if it is okay. So sometimes we have to slow ourselves down in those spaces. Doctor's visits can be so quick, or sometimes they'll just run through things that we may not necessarily understand. Slow them down, ask questions. Don't just blur through things that are really important to your well-being. Which leads me to my second point, taking off our mask. Oftentimes, we are so conditioned to wearing a mask to hide our true feelings, our pain, and our symptoms. If you are interested in true healing, if you really want to protect your body, take off the mask. So many of us are taking prescriptions to mask root problems. That's like putting masking tape on a water leak. That's not protection. Or taking hormonal birth control for painful or heavy periods, or using biofreeze for a repeat backache. That's just putting Band-Aids on a wound that needs medical attention. It's okay to not be okay. It's okay to keep going when your body is showing you signs that it needs attention. My next point is to read. I am all about informed consent. Whatever healthcare choices one make, I support them as long as that decision comes from a place of understanding, comprehension, and clarity. Read those consent forms. Read the ingredients, risk, and adverse reactions to medications and injections. The best thing you can do to protect your body is not put a single ingredient in your body that you can't pronounce or that you can't understand. Read your food labels, read every label. If an 8-year-old can't pronounce the ingredients, then they are likely not desirable for your body. Read everything. If you go into an appointment and haven't had a chance to read and prepare, delay all decisions and schedule a follow-up appointment for decision-making. Take up space, sis. And next, my fourth point is protecting ourselves in pregnancy. I had to throw this in as a midwife. I have 5 suggestions for ways we can protect our bodies during pregnancy. Choose a provider that listens to you, respects you, and does not dismiss your concerns. Stop rushing your baby out. So what if your baby is due on Christmas Eve? That is no reason to get induced on December 19th. When we interfere with nature, we are doing the opposite of protecting ourselves. Our bodies were designed with the power to conceive, carry, birth, and breastfeed our babies. Keep your pants on. Consider denying cervical checks if you are not in active labor. You can still deny them then also. To fully inform yourself, weigh the risk and benefits of cervical checks. Your doctor sticking their fingers in you at 35, 36, even 39 or 40 weeks to check and see if you are dilated is harmful. It subjects you to being medically raped, which some practitioners will sweep your membranes without your consent. That can nudge you into labor. But let's say your body isn't ready. That increases your risk for a catalyst of interventions. It also increases your risk of infection, which increases your chance of preterm delivery and needing even more medical interventions. Be more intentional with your nutrition. Black women, we don't eat enough protein. During pregnancy, our bodies require 80 to 100 grams of protein a day. It's best to get as close to 100 grams as possible. Not eating enough protein is a huge part of the reason why Black babies statistically have lower birth weights. Not eating enough protein is a part of the reason why Black women have higher rates of preeclampsia. Stop listening to hearsay and other people's birth trauma and prepare for the birth you desire. Read. If purchasing books about birth aren't in your budget, utilize your local library. Contact your local midwives. Most of us have blending libraries that we are so willing to share with our community. If you can't hire a midwife and a doula, hire an apprentice midwife like myself. I created a virtual service to provide supplemental prenatal care for mamas that don't have access to a midwife, but understand they deserve better than the standard of care through the hospital system. During those supplemental prenatal visits, we go over diet, hydration, nutrition, labs, prenatal education, goals, mental and spiritual wellness, advocacy, upcoming testing, and everything else concerning pregnancy. When you go visit your OBGYN, those visits are less than 10 minutes long. If you are seeing an OBGYN, you deserve affordable supplemental prenatal care. And my last point is to report them. Protecting our bodies sometimes look like not allowing a medical provider to continue to have access to us. Report, report, report. If you are not feeling seen, heard, or respected from your provider, fire them. Report to social media, report to Google reviews, report to Rate My Doctor, report to their superiors, and fill out hospital surveys. Make it known, fill out hospital surveys, make it known if you had a less than a compassionate experience with a medical provider. Protect yourselves by walking away. Protect your sisters by giving them a heads up and not being silent about things that matter. Sharing is caring. Your experience is evidence, and we believe you. As I close, protecting our bodies, it sometimes looks like keeping our pants on during prenatal doctor visits, but sometimes it looks like finding someone who actually cares. It's okay if you have to find a telehealth provider across the country or across the world to consult with. Protect your body by not settling, not just going with the flow because it's easy, because you're tired of going to visits. I'd also like you to reflect later today on ways you can protect yourself in your personal life and in healthcare settings. Protecting our bodies is protecting our future generations to come. We lead by example. We are teaching our children that their consent matters. We are setting the standard for how we deserve to be treated, because if we don't protect us, who will?